Okay, let's look at where each hormone is acting on. So ANP is acting on the afferent arterioles. Secreted in response to increase in atrial pressure causes indirect afferent arteriolar dilation through inhibition of the NE, causes increase in GFR and increase in sodium filtration with no compensatory sodium reabsorption in the distal nephron. Net effect is sodium loss and volume loss. ANP net effect is natriuresis and volume loss. Okay. Then we have this angiotensin 2. Synthesized in response to decrease in blood pressure causes efferent arteriolar constriction, increases GFR, increases filtration fraction, but no compensatory sodium reabsorption in proximal and distal nephron. Net effect, preservation of renal function by increasing filtration fraction in low volume states with simultaneous sodium reabsorption, both proximal and distal, to maintain circulating volume. That's the angiotensin 2. Okay, let's talk about the aldosterone now. Aldosterone acts on this all area. It is secreted in response to decreased blood volume via angiotensin 2, and increase in plasma potassium concentration causes increase in sodium reabsorption, increase in potassium secretion, increase in hydrogen secretion. So basically, net effect for aldosterone is you have increase in sodium in the blood and decreasing in the potassium in blood and hydrogen. Okay. PTH secreted in response to decreased plasma concentration of calcium and increase in plasma phosphate concentration and decrease in plasma active vitamin D, causes calcium reabsorption DCT, decreased phosphate reabsorption PCT, and increase in active form of vitamin D production, increased calcium and phosphate reabsorption from gut via vitamin D. Okay. For ADH is secreted in response to increase in plasma osmolality and decrease in blood volume, binds to receptors on the principal cells, causing increase in number of aquaporins and increase in water reabsorption, increases reabsorption of urea in collecting ducts to maximize corticopapillary osmotic gradient. Now, importantly, one thing to mention at this stage is the summary of what we had. So here is what we have. So this all, the green area, this is all permeable to water. Highly permeable to water. So highly permeable to water. And this blue area this is non-permeable to water. Okay, but if you have increase in ADH, this would lead to high permeability of water. If you have low ADH, this leads to low permeability to water. So that's all for the hormones acting on kidney.